Hello and welcome to Med Talks with Dr. Moin. Today we have a wonderful man with us who is a neurologist, Dr. Padmakar. Dr. Padmakar is a consultant urologist who works at Apollo Hospitals, Hyderabad. Sir, thank you so much for sparing your valuable time for our viewers and thank you for visiting our facility. Sir, I have heard about a term, they call it prostatomegaly. So, what is a prostate and what does prostatomegaly mean?
I'll tell you a story. When a gentleman starts graying his hair,
Okay.
when a gentleman starts developing rings around his
He becomes a megastar?
and a gentleman starts developing little bit of a coronary heart disease at the same time. I mean,
Okay.
elderly man who's, would say 50.
Mhm.
Not elderly, we
Okay.
can't say 50 as elderly, it's a middle age.
Okay.
So middle-aged gentleman, if he starts developing urinary frequency, he's getting up in the night. Earlier, he never used to get up in the night.
Okay.
Suppose he goes to sleep around 10:30, gets up in the morning at 6 o'clock.
Mhm.
So in between this, about 6 to 8 hours of sleep,
Okay.
normally one should have it.
Mhm.
If he's getting up without his any disturbance,
Right.
just to go to toilet, to washroom, then obviously there is something wrong.
Okay.
A gentleman who goes to toilet and keeps staying there for more than 20-30 seconds, obviously there is something wrong with him
Okay.
at the urinary system.
Okay.
A gentleman who's in a meeting, excuses himself,
Mhm.
then go to a washroom,
Mm.
there is a problem there.
Right.
These are the
Indications.
indications where you need to pick up. There
Yeah.
is something wrong. It is not normal.
Normal.
So these are the times in an elderly, middle-aged gentleman who starts developing prostate. Prostate is like any other gland, like salivary gland, thyroid gland. Any other gland is a gland which is there and situated inside the urinary bladder, just below the urinary bladder neck.
Okay.
It adds up to the secretions, especially during the semen quantity.
Okay.
It enriches the sperm during for the fertilization.
So it means what? You won't find a prostate in women.
Yes, lucky.
Yeah.
God has been
like
kind,
you won't
at least.
find like you won't find a uterus in men. You won't find a uterus prostate in men.
And men, yes, that is true. At least the women are relieved of their monthly issues after 50. The men starts developing their problems after 50.
Yeah.
I'll put it this way, isn't it? So God
Yeah.
compensates somewhere,
Yes. Yes.
isn't it?
Exactly.
So
exactly.
he doesn't let you sleep well.
Right.
Okay, these are the symptoms which normally feel that this enlargement of the prostate. What does it do? Benign enlargement of the prostate is but natural. It occurs naturally.
Okay.
It is not that my habits definitely turns into from bad to worse, but symptoms are there in every male who's 50 plus. It is some people they are lucky that it drags on till 60. Some people are lucky till 70 also they don't. It's all what we call, if they say, God's given.
Is there any way you can bypass that, or it's just as you said, like graying of hair? It happens.
Bypass.
Bypass prostatomegaly or prostate.
Then get your prostate treated right when you're a child.
Yeah.
which is impractical, which is
Impractical.
illogical. So once these symptoms are there, then urologist examines and starts the treatment. Initial stages itself, with one single tablet, we'll have a normal
Okay.
urinary system without any disturbance.
Okay.
It's very easy, but you have to address it and go to a doctor. Doctor does few tests, and it's
Okay.
very simple and easy and cheap also. It's not that we need to undergo an expensive CT scan and MRIs.
Okay.
Simple ultrasound done as a day-to-day basis. In the clinic itself, within 1 hour, we get the report
Mhm.
and we can get the treatment started. Straight away, it improves without any issues.
Sir, does every prostatomegaly, the increase in size of prostate, has got some what you call incidence or relation to the cancer?
Exactly. It's a good question. You see, like any other cancer, prostate cancer is also one of the cancers. But amongst the enlarged prostates, about 2% of them would turn into a malignancy.
Okay.
Again, coming back to a gentleman who's about 70,
Mhm.
who develops prostate cancer, normally Indian average of human life is around 70, 65, 70. I think it is increased now to 70, 75. So prostate malignancy is easy to treat. Not very major operations required. Only very few patients where we do a radical prostatectomy. Otherwise, with good injections and medication, we can easily control.
Okay.
Eradication of the disease is not there, but definitely we can control.
Okay.
I say without any change in lifestyle.
Okay.
I say about 70-year-old man is detected with his prostate cancer with few injections, with a minor surgery. He will continue till 80 years of age.
Okay.
That means he completes his life
Yeah.
without much of a disturbance.
Right.
No major chemotherapy.
Right.
No major operations.
Right. So if you just meet the doctor in time with your problem, your problems can be treated and you can have a wonderful life even after you undergo surgery.
That's right.
Sir, now coming to the renal stones, they call calculus, renal stones. Sir, are these renal stones common in young men, women, or like elderly people?
Renal stone itself is a big subject.
Right.
I say renal stone is they're congenital also. Some people are
Okay.
some chromosomal abnormalities, some genetic abnormalities. It runs in the families. They develop stones even during childhood.
Okay.
Even sometimes we do pick up the stones when the baby is still in the mother's womb. As the child keep growing, obviously they keep eating. Eating habit becomes little irregular when the child grows into adolescent and adolescent becomes adult.
Right.
So excess consumption of anything like calcium containing food, definitely a calcium and high protein as well as high fat content could cause a little bit of a high incidence of kidney stones. Any person who develops repeated urinary infections which are not being treated properly, they do develop stones.
Okay.
A patient who has a urinary obstruction, again I told you, the prostate is one of the cause of obstruction to the urinary in males. They do develop stones in the bladder.
Okay. Sir, has this alcohol got some incidence of stone formation?
I'll tell you one small story about the alcohol, or I call beer.
Okay.
So everyone says that a young man is developed a stone. The grandparents or a friend or a neighbor who says, "Zyada beer pee lena," वो निकल जाता अपने आप. So this guy, because of he develops a stone,
then he becomes an
beer
alcoholic.
Beer is nothing. It swells in the body.
Right.
It increases the urine output. Yes, it's a diuretic. And some of them are lucky that even if you drink a couple of liters of water, it would cause the same effect.
Right.
And this guy is tipsy after 4 bottles of he keeps on passing urine. So alcohol any day, any time, any place is not good. Stop alcohol.
Got it, sir. Got it.
So it causes unnecessary complications like stone disease, kidney cancer, bladder cancers. So alcohol is no good.
So we have just came to know about one good substance which is available in all our states, in our country, and it is not expensive. But life is going to be very expensive if you just fall prey to those substances. I'm not going to name all those substances, but you guys know, as sir has said, alcohol is injurious to health.
Consumption of alcohol.
Consumption of alcohol, yeah. I should say that. Consumption of alcohol is injurious to health. We are talking about kidney stones. Sir, what are the various types of stones, various sizes of stones? And I just heard that there is a stone in the form of a small ball, and there is a stone which is like hard and it looks very dangerous in the form of a rock. And sir, how to deal with these stones?
A stone is a stone. Stone is formed in the chemical nature of the stone in what we call commonly stone. I mean, they are part of it. Calcium, oxalates, phosphates, and some other many smaller elements which are there in the body, which are there in the blood, which could contribute to the formation of the stone.
Okay.
Basically, the calcium oxalates and phosphates.
Okay.
They constitute major part of the stone.
Okay.
The nidus for the stone formation. The nidus, I mean the stone. How does a stone form? A stone doesn't form in overnight,
Okay.
like a 5 centimeter stone or 2 centimeter stone.
Okay.
Stone forms like a crystal first.
Okay.
The food what we consume has plenty of calcium, oxalates as well as phosphates, gets into our blood. But all those people, those who are consuming the same food, what do you mean? 100 people, they go out to eat the pizzas and burgers.
Right.
Not all of them develop stones.
Right.
What is the reason? Or I'll put it this way, there are 5 members in a family, only 1 or 2 developing stone.
Right.
What are the reasons? Obviously, a patient, a person who comes with a stone has to have some kind of a predilection for the stone formation.
Okay.
A patient has some genetic abnormality, probably we don't know. A gene which is carrying the stone formation or the patient is carrying. That's why
Okay.
the amount of calcium which is running around in his blood gets filtered into the kidney.
Right.
That forms the nidus for the stone formation.
Okay.
Once the nidus forms,
Right.
there is addition of layers of calcium and oxalate all around.
Okay.
Calcium and oxalates in the body becomes calcium oxalate and
Okay.
becomes a stone. A stone keeps on increasing as the age increases, as the abuse of this food
Okay.
also keeps on increasing.
Okay.
The size of the stone doesn't matter at all.
Okay.
A smaller the stone causes pain
Okay.
because it starts. The natural occurrence is that a stone which is there in the kidney with a flow of urine starts moving down.
Okay.
Once the stone starts moving down to the ureter, because the diameter of the ureter is very small,
It obstructs.
that's why it causes little obstruction for the urine to flow.
Okay.
Thereby, a patient develops pain.
Okay.
As such, when the stone is growing inside our body, we can't make out.
Okay.
It's only the pain. Pain only comes when the stone starts moving.
Okay.
I'll put it this way. Pain causing stone is better stone rather than a silent stone which is
hidden.
keeps on increasing in your body
Okay.
and damages the kidney.
Okay.
In my practice, I've seen stone from 2 millimeters to a cricket ball size.
Oh my God.
I still have a patient now admitted. Tomorrow I'm going to operate.
Okay.
That patient, I've done a cystoscopy and found that there is almost, if not cricket ball, definitely a hockey ball, smaller one,
Okay.
little bigger than a golf ball.
Okay. It is in the kidney.
It's in the bladder.
It's in the bladder.
It's in the bladder.
Sir,
So,
it descends down and it grows in the bladder.
some stones develop into the bladder only.
Okay.
Some majority of them they descend, and bladder is a kind of a bag where urine collects, and keep collecting the urine there with high calcium content, high solute content.
Okay.
The stone keeps increasing in size.
Okay.
Okay. The best method is to investigate for the cause,
Right.
investigate how to treat the patient.
Okay.
During my post-graduation days, when my formative days, majority of the kidney stones were treated by operations only, by cutting and taking out.
Okay.
But with present invention of so many non-invasive or minimally invasive techniques, like we can make a hole in the kidney called PCN to take out the largest stone.
Okay.
We have a retrograde intrarenal laser surgeries where we can get into the normal passage of the urine,
Okay.
get into the kidney, reach the stone, pulverize the stone into small pieces and suck it out. Other
Okay.
part we call non-invasive, totally non-touching, that is called extracorporeal shockwave lithotripsy.
Is that what people in the layman's language they call laser surgery?
Laser
for the
surgery. Laser
kidney?
surgery. Laser is an energy source. It can be used anywhere, ENT surgery or a bladder surgery or stone surgery. Laser causes disintegration of the stone.
Right.
This extracorporeal shockwave lithotripsy or ESWL in a short form, what we call, patient is put under just like you must have seen an X-ray being
Right.
taken. X-ray of the abdomen.
Right.
Your patient is on the table,
Right.
X-ray tube there on the top, it keeps releasing X-rays.
Some beam.
And we focus the stone, and some beam electromagnetic waves are being sent. But these are the stones. Every stone can't be broken like that. Some
Okay.
stones are very hard, some stones are very soft, and some stones are needs to be operated also. Even presently, even in 2021, we do operate. Earlier, we used to operate 80% of the cases. Now we do only 10% of the cases.
Okay.
Rest of the 90% we do with a non-operative or minimally invasive operations.
Okay.
The treatment has become very easy.
Okay.
The incidence of stone disease has become more.
Okay.
Probably that is because of the investigations.
Okay.
Pickup rate is also more.
Pickup rate is more probably.
Probably those days we never used to pick it up.
Sir, what are the set of investigations you would advise for a person who has got pain in the lower back,
A gentleman
suspecting
or a
a
lady,
stone in the kidney?
see, not all those pains are related to the stone disease.
Somebody who is suspecting a kidney stone.
Exactly. A person who has a pain from the loin to groin, what we call in a shorter term, loin to groin.
Right.
Loin is a backside. If the pain transmits or radiates down to the groin area, 90% of the time it is to do with a ureteric stone.
Okay.
So these are the patients where we need to examine first. Once we examine the patient, then we will come to know. A simple X-ray or an ultrasound in an OPD procedure will pick up about 50 to 60% of the stones. But those smaller stones and stones which are not very well visible on X-rays, we need to get a CT scan done. Presently, the CT scan is not very expensive, but it has to be done to locate the stone first.
Okay.
Second is to number how many stones are there. Many more stones which are not causing any pain. Third, how to deal with the stone. We all come to know through this investigation called CT scan of the abdomen. Whether we use contrast or a plain CT scan, that depends upon the patient to patient.
Okay.
Then once we ascertain that these are the causes, these very many stones are there, we can easily treat them. Taking out stone is not an issue.
Okay.
The most important issue is how to prevent the stone formation.
Okay.
Further stone formation. That is the more. Because
Right.
a 30-year-old gentleman, he has to live for another 30 years,
Right.
keeps on developing these stones,
Right.
disturbs his daily work and his health, and drains out all his resources.
Right.
Then it's not right. So doctor has to ascertain, the urologist, what is the cause for stone formation,
And how to further prevent it.
how to prevent. And dietary
Right.
regulations is the most important factor here.
Yeah.
Consuming water. Water, I mean, how many glasses? Everybody says, can I drink about 100 glasses of water? No, it's not that. Or I might say some naturopathies, they say keep on drinking 2 liters in the morning, 2 liters in the afternoon, 2 liters in the evening. I mean, this is not a toilet drain where you can flush it out.
Yeah.
Okay, kidney has its own limitations, especially those who are 50 plus, those who have heart disease, those who are on medication for the heart. Excess consumption of water is very dangerous. That
Right.
causes a lot of heart abnormalities, heart ailments. Coming back to how much to drink. At simple terms, in our day-to-day living areas where you see, if you are habituated to drink 1 glass of water during your breakfast, consume 2.
Okay.
During lunchtime, if you are habituated drinking 1.5, 2 glasses of water, consume 3.
Okay.
Add 1 more glass to your regular routine.
Okay.
That would come to about 2 to 3 liters of liquids in 24 hours.
Okay.
Coming back to this, during summer, we'll use a lot of water from our insensible loss, what we call,
Right.
like sweat.
Sweat.
Not everyone goes in an air-conditioned environment.
True.
Because of the humid weather, you keep losing a lot of water. There, we need to consume at least a liter extra.
Okay. Okay.
Similarly, a severe winter, if you keep on drinking plenty of water, you have to sit in the toilet. So,
Yeah.
you cut down according to the
Right.
season as well as the weather which you are living in.
Yes.
Consumption by water, by say in a common term, 2 to 3 liters in 24 hours would be enough for a common average healthy gentleman.
Okay. Thank you, sir. Thank you for giving the valuable information to our viewers. This is going to be of great help for all of our people who are going to be your patients or going to have urology problems. I should not say that anybody should have urology problem, but I just want to stress on this point that anybody having these symptoms should always meet the specialist and get your problem solved.
Thank you.